Welcome to Depictions Media Radio. Welcome to Policy and Rights, the show about human rights and government policy. Okay, welcome back everyone to Policy and Rights. Here on Depictions Media Radio, I am Michael Clogs, your host today. And we're going to start off, of course, in British Columbia, because we're based here in British Columbia. You know, when you go on a road trip and you're driving through the mountain passes and everything, and you lose your cell signal. Well, BC Highways is out to improve that. There's improvement cell service coming to BC Highways 95 and 97 as a recorded investment from the Connecting British Columbia program continue to benefit people throughout the province. So a quote from Lisa Bear, Minister of Citizen Services: "We're miles apart. These two highways have many things in common. They are difficult for winter driving conditions, and they're prone to sudden road closures, and they have large gaps without cellular service. We can't change the weather, but we can make a strategic investment to help expand highway cellular service in BC. With these latest projects, we are on track to more than triple our target to increase highway cellular coverage, making our highways safer than ever before." They are actually putting from Rogers $5.7 million into the program, which there's estimated $6.4 million of costs in filling the gaps in 68 kilometers of Highway 97 between Chetwynd and the Highway 39 junction. The route includes a Pine Pass and populated area prone to avalanche conditions. Cellular service will also be made available at West Pine Rest Area and Powder King Mountain Resort. So there's going to be lots better cell service on those mountain passes of BC highways. So with that, John Horgan, yesterday, he is campaigning with community leaders to get as many people registered for vaccine as possible. And he met with a virtual meeting yesterday to enlist community leaders, helps religious and faith people, and along with that, they're expecting to get over 1 million doses of Pfizer in May, and we need, and the quote is, "We need everyone in BC to register today. They're ready to so they are ready to receive their COVID-19 vaccine." Community leaders have been played a critical role in spreading awareness about health guidelines and vaccine rollouts. So there's going to be millions of doses coming, and they need everybody to go on to their website to register for the vaccine, and which would be at gov.bc.
Health Officer. This is our COVID-19 briefing for Monday, May the 3rd for British Columbia. We're honored to be here today on the territory of the Musqueam, of the Squamish, of the Tsleil-Waututh First Nations. We're honored to be here on their lands. Tomorrow, Tuesday, and Wednesday, we'll be giving written briefings at 3 o'clock with updated information about the COVID-19 pandemic in British Columbia. On Thursday, we'll be providing an in-person briefing, Dr. Henry and I, this time from the offices of the Fraser Health Authority in Surrey. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you very much and good afternoon. So today we're reporting on the 3 periods over this past weekend. Between Friday and Saturday, we had 835 new cases of COVID-19 diagnosed in British Columbia. From Saturday to Sunday, an additional 671 new cases, and in the last 24 hours, an additional 668 people were diagnosed with COVID-19. So that's a total of 2,174 new people diagnosed over the weekend, bringing our total in British Columbia to 131,656 people in our province who have had COVID-19. That includes, over the weekend, 438 people who live in the Vancouver Coastal Health Region, 1,509 people in the Fraser Health Region, 61 people in the Vancouver Island Region, 106 people in the Interior Health Region, and 60 people who live in the Northern Health Region. We currently have 7,327 active cases around the province, of whom 474 are in hospital, 176 people in ICU or critical care. We have an additional 11,781 people who are under active monitoring and 122,518 who have recovered from COVID-19. The 2 outbreaks that we've had at the Prince Rupert Regional Hospital and at Abbotsford Regional Hospital have now been declared over, and we have 1 new outbreak at Lionsgate Hospital. That leaves us with 8 active outbreaks in long-term care, assisted living, or independent living, and 3 in acute care. Over this past weekend, we've had 15 more people in British Columbia who've died from COVID-19, bringing the total number of people in BC to 1,596. As always, our condolences and our thoughts are with the families who've lost a loved one over this past weekend, with their care teams in the communities. We know how challenging it is to mourn somebody during these continuing difficult times. Just to put that in a little bit of perspective, the majority of the people, everybody who passed away over the weekend was over the age of 70, with the exception of 1 person who was in their 50s. And most of these deaths occurred in hospitals. As you know, the focus of our vaccine program continues to be to protect as many people as possible, as quickly as possible, to reduce the risk of transmission and the risk of hospitalizations across the province. In addition, we're addressing hotspots and reducing overall transmission. To date, we've delivered 1,877,330 doses of all 3 of the COVID-19 vaccines that are available here in British Columbia. Of those, 91,731 are second doses. Everybody in BC now who's 18 years of age and older is eligible and should be registering on our Get Vaccinated website, or by calling 1-833-838-2323. This is the simplest and most effective way to get your dose of vaccine as soon as possible. Registration is required only once, and I know some people had some concerns about whether when they receive their vaccine through a workplace program or through a pharmacy program for the AstraZeneca vaccine, do they need to register? And yes, it is helpful to register again, just the once. But if you do register more than once, the system will recognize that as well. Once you are registered, your dose will be reserved for you as soon as the program becomes available, and you'll be notified when to book. This is the most efficient way that we can do this, and appointments, as you know, are now being booked for people, everyone age 54 years of age and older. So if you're older than 54 and you've not yet received a notification to book, make sure you check on whether you've been registered and go online. If you register right away, you will be able to book right away. With more vaccines arriving this week, these appointments will also be speeding up. The most efficient way to get your vaccine, and right now in our age-based program, the basis of our program is the Pfizer and Moderna vaccines that we're receiving in greater and greater quantities in these next few weeks. So register now is important. We have reached a new and encouraging point in this vaccine supply. Starting today, the vaccine that we will be receiving will be increasing significantly. In the month of May alone, we'll be receiving over 1 million doses of vaccine available for people across the province. This is good news for all of us. It means that everybody who is eligible, so right now that's down to age 16, will have access to a vaccine before Canada Day, and we think significantly before that. And that leads us to think about the interval we have between the dose 1 and the dose 2. As you know, the most important thing that we know will help stop transmission and protect everybody is to get as many people as possible their first dose of these vaccines as soon as we can. And with the new increased supply that we have, we are looking at the potential of decreasing the interval to less than 16 weeks for most people. Right now, those people who receive their vaccines early on in the program are getting notified about their second dose, and we've been doing that and will continue to do that as more people get up to that 3-month mark in the next month. But as we open up immunization to all adults and we get everybody with their first dose, we'll be able to speed up those two as well. And we're looking at how we can do that in the coming months and weeks ahead. We're moving as quickly as we can to get vaccine into arms and to keep this in step with the supply that we have. The clinics that we've set up are ramping up this week to be able to deliver the vaccines that we expect to receive. But we know that there's been glitches along the way, particularly with our IT system that we've been developing to make sure that we've recorded every dose that everybody has, both for safety reasons and also for your permanent record. In some ways, we've been building a spaceship as we've been flying it, and we're now entering into a new era, a new warp speed, if you will, and there's bound to be bumps along the way. But we will adjust. I know that over the weekend there was some concerns about people registering who'd already received a single dose, and we're getting messages about registering again for their first dose. We will take care of those glitches. There's bound to be more that will arise as well as we're getting more and more vaccines and another 1 million doses into people over these next few weeks. But everybody will get their vaccine and will get their turn, and that turn now is coming soon. I know as well there's some concern about people who've received AstraZeneca and whether there will be second doses of AstraZeneca available for people. We are hearing that, yes, Canada is looking to make sure that we have the supply we need. And we are also watching very carefully what we call the mix and match studies that are going on around the world, particularly in the UK, and we will have more information about that. It may turn out that it is a better, stronger immune response to receive a second dose with a different vaccine. We don't yet know that, but it could be that we'll be able to provide the mRNA vaccines like Pfizer or Moderna as a second dose for people who've received AstraZeneca, or vice versa. So those are the things that we will continue to follow, and when we get that information, we'll provide it to you. We know that the vaccine is coming in increasing amounts. And when we think about our pandemic and what we are going through right now, what we're seeing is decreasing, slowly but surely, decreasing case rates in our communities. And when we think about how transmission occurs, it's like a path with many, many forks in the road. In some cases, it's one person that transmits to one other person, and that goes on. But in some cases, we know with this virus that it can be a situation where one person transmits to many others. And we know there's certain situations, certain environmental conditions that make that more likely, what we call super spreader events, when one person can affect many people. And that's the way that this virus tends to spread. And that's why we've been focusing so much on reducing those situations where that can occur. That means keeping your numbers small, being outside rather than inside, making sure you're wearing masks and keeping distance when you're inside in particular. We've been on a very steep upward trajectory in our case curve over the last few weeks, and our hospitalizations remain high. And as we know, there are many people right now in critical care and ICU. But there also are some encouraging signs that our efforts are working, that we're starting to come down on the other side of the curve. And as we've seen in places like the UK, the US, once we get down that curve, we can start to see dramatic decreases and more people in our communities protected and preventing transmission. But we need to keep doing the measures that we know worked to prevent us from transmitting to everybody else. What we need to keep doing, it's up to all of us to take those measures to stop the spread. And that means staying local, keeping small, staying away and getting tested if you have any symptoms at all, and getting vaccinated when your turn comes up. And I will also say, reach out to your neighbors, your friends, those you know, to help them get vaccinated as well. We know in some people it's still a very complicated process, and we can all help each other get that process, make it simpler. It's going to be a while before we no longer see new cases, but we need to keep doing our bit to stop those chains of transmission and stop the chance that it's going to spread to large numbers of people. And the things that we are making a difference, and we need to hold the line and keep doing them for the next few weeks. We don't want another upward climb, and we know that that can happen if we take our eye off the end game too soon. So let's continue to do our part to not allow COVID-19 an opportunity to increase anymore. We know that we can do this. We know that these small and large sacrifices that we're making every day are making a difference, and that will save lives. We need to use our collective effort and momentum to keep going now through these next few weeks as more and more vaccines are available. And we need to remember every day that we're getting closer to a time where this pandemic will no longer be controlling our lives, and that we will be able to control this virus. I also want to mention that our Speak survey is still open for another week, and to date about 178,000 people have completed this survey. If you haven't done so, though, please take a few minutes to do that this week. If you live in some of the more rural or remote areas of the province, if you're a male, if you're over 75, and people from BC's many different ethnic groups, we encourage you to have your voice, to add your voice to this survey so we know pandemic and the measures that we've taken have affected you and your communities. And the survey is available on the BC CDC website under COVID-19 survey. Thank you very much, and remember that we will get through this period together. We're making a difference now, and we need to hold that line and remember to continue to be kind and to be calm and to be safe. Thank you.
Okay, so latest numbers from the public health is 142 new cases in the Vancouver Coastal Health, 456 new cases in the Fraser Region Health, 19 cases in Island Health, 65 cases in Interior Health, 14 cases in Northern Health. As we look at the numbers, that the Fraser Health also includes Surrey, BC, which is a known hotspot, and we also have reported several times about the teachers wanting to do something to slow the school system down so that students and teachers are safe, and there has been no word, one way or the other, on that from public health or from the Minister of Education. So we'll keep on that until we actually hear that something is actually being done. There is also word that under the age of 15, that there are current studies going on to see if the vaccine is viable for lower age groups, in which case maybe there be a vaccination program for our youth and our children. So we look forward to that sort of thing happening also. Okay, so of course here in Canada, that recently they have approved the Johnson vaccine, and we have a progress report from Health Canada and NACI. So let's listen to that next. Thank you for listening to Depictions Media Radio.
In today's technical briefing on the National Advisory Committee on Immunizations, or NACI's guidance for the Janssen COVID-19 vaccine. Bienvenue au briefing technique sur les conseils du Comité consultatif national de l'immunisation pour le vaccin contre la COVID-19 de Janssen. Today we will hear remarks from NACI's Vice Chair and Chair, Drs. Shelley Deeks and Caroline Quach. Dr. Howard Njoo, as well as Matthew Tunis from the Public Health Agency of Canada, will also be available to answer questions during the Q&A session. Aujourd'hui, nous entendrons les allocutions des Dr. Shelley Deeks et de Caroline Quach du Comité consultatif national sur l'immunisation, de Dr. Howard Njoo ainsi que Matthew Tunis de l'Agence de la santé publique du Canada seront disponibles pour répondre aux questions lors de la séance de questions et réponses. Note that the content of today's briefing is for attribution. If you wish to ask a question, please press *1 on your phone. Veuillez noter que le contenu de la session d'aujourd'hui est pour attribution. Si vous désirez poser une question, veuillez appuyer sur étoile 1. We'll now begin today's technical briefing. Over to you, Dr. Deeks.
Thank you very much. And good afternoon, everybody. Dr. Quach-Thanh and I are pleased to be here to present two key updates to NACI's guidance on the use of COVID-19 vaccines in Canada. As a quick reminder, NACI is an independent committee of experts that provide evidence-based advice on the use of vaccines. NACI assesses how to use authorized vaccines to achieve the greatest public health benefits. We analyze the spread of COVID-19 in Canada and the risks for population subgroups. We review vaccine safety and effectiveness data from clinical trials and real-world studies, and consider the availability of other vaccines to develop advice on the equitable use of vaccines in immunization programs in Canada. NACI continues to review evidence as it evolves. This is why Canadians should expect NACI to update its guidance as new data become available. We are in a time when new evidence is emerging rapidly. Provinces and territory considered NACI's advice when designing their immunization programs, but the policy decisions rest with them. COVID-19 continues to cause hospitalizations and deaths across Canada, and some jurisdictions are experiencing devastating rates of illness and hospitalizations, straining their healthcare systems. Vaccination is essential to end the COVID-19 pandemic. NACI encourages Canadians to get vaccinated to protect themselves, their families, and their communities from illness, hospitalizations, and death from COVID-19. Canada now has another COVID-19 vaccine available to them. On March 5th, Health Canada authorized Johnson & Johnson's Janssen vaccine for use in individuals 18 years of age and older. NACI's guidance is being issued now as the vaccine becomes available in Canada. The Janssen vaccine is a single-dose viral vector vaccine that can be stored and transported at normal refrigerated temperatures. In clinical trials, the single-dose Janssen vaccine was 67% efficacious in preventing moderate to severe symptomatic COVID-19 infections across all age groups at least 2 weeks after receiving the vaccine. The vaccine was also highly efficacious in preventing critical illness and hospitalization. In addition, preliminary evidence suggests the vaccine offers protection against the B.1.351 variant of concern, first identified in South Africa, and the P2 variant of interest, first identified in Brazil. There is currently no data on the P1 variant of concern, first identified in Brazil. As with the AstraZeneca vaccine, there have been confirmed cases of vaccine-induced immune thrombotic thrombocytopenia, or VIT, after administration of the Janssen vaccine. As of April 23rd, 17 cases have been confirmed following the administration of more than 8 million doses of Janssen vaccine in the United States. The U.S. Advisory Committee on Immunization Practices, NACI's U.S. equivalent, held emergency meetings to review the safety signal and concluded that the benefits of Janssen vaccine outweigh the risk. Similar to the AstraZeneca vaccine, NACI weighed the benefits of the Janssen vaccine in saving lives and protecting populations against serious complications of COVID-19 against the risk of developing VIT. At this time, based on the current evidence, NACI recommends that, similar to the AstraZeneca vaccine, the Janssen vaccine may be offered to individuals 30 years of age and older without contraindications if the individual prefers an earlier vaccine rather than waiting for an mRNA vaccine, and if the benefits outweigh the risk. This recommendation provides provinces and territories with recommendations on how to optimize the use of the Janssen vaccine in their jurisdictions to achieve the greatest public health benefit. The public health benefit risk analysis for the use of the Janssen vaccine may vary between jurisdictions because of the differing epidemiology. Provinces and territories adapt NACI's recommended age threshold based on their unique circumstances, including local COVID-19 epidemiology, local vaccine supply, and logistics and equity considerations. For example, as a single-dose vaccine, the Janssen vaccine may be better suited for populations that are harder to schedule for a second dose. Health officials can refer to a risk assessment tool in the updated statement to help them determine how to use the Janssen vaccine. NACI continues to preferentially recommend authorized mRNA COVID-19 vaccines due to the excellent protection they provide and because VIT has not been associated with the mRNA vaccines. NACI notes that Canada has procured and is expecting enough mRNA vaccines to fully vaccinate the currently eligible Canadian population before the fall of 2021. NACI has also reinforced its recommendations for vaccination during pregnancy. NACI recommends that a complete vaccine series with a COVID-19 vaccine, preferably an mRNA vaccine, may be offered to pregnant individuals if the benefits outweigh the risks for the individual and the fetus, and if informed consent includes discussion about the evidence of the use of COVID-19 vaccines in this population. A recent study in the United States showed no safety signals of concern following the administration of the mRNA COVID-19 vaccines during pregnancy. In addition, the treatment of VIT during pregnancy, should it occur following vaccination with a viral vector vaccine, can be quite complex. For these reasons, NACI preferentially recommends the use of mRNA vaccines during pregnancy. At this time, NACI also continues to recommend that people previously infected with the SARS-CoV-2 virus be offered a complete series of a COVID-19 vaccine. In the absence of one-dose vaccine effectiveness data in people who were previously infected and limited second-dose safety data, people with previous SARS-CoV-2 infection should continue to receive a complete vaccine series regardless of the severity of their previous infection. NACI will continue to monitor the emerging evidence on this topic and will update our recommendations as needed. For additional information on NACI's updated recommendations, including the evidence and rationales behind the recommendations, please visit the NACI webpage. In closing, I would like to highlight that NACI continues to review evidence and data on COVID-19 and COVID-19 vaccines as it becomes available. We will continue to update our recommendations on the use of COVID-19 vaccines in Canada as needed. Thank you for your time, and I'm going to pass you over now to Dr. Quach-Thanh.
Alors bonjour, je suis heureuse d'être présente aujourd'hui avec la Dr Deeks afin de vous résumer 2 mises à jour importantes du CCNI sur l'utilisation des vaccins contre la COVID au Canada. Pour rappel, le CCNI est un comité d'experts indépendant qui fournit des conseils fondés sur des données probantes quant à l'utilisation des vaccins. Le CCNI évalue l'utilisation des vaccins dans le but d'obtenir les plus grands bénéfices en termes de santé publique. Ainsi, en plus des données des essais cliniques, le CCNI tient compte des données sur l'efficacité provenant de l'utilisation des vaccins en situation réelle, de l'épidémiologie de la COVID-19 au Canada et de la disponibilité d'autres vaccins contre la COVID-19 afin de développer ses recommandations pour leur utilisation équitable dans le cadre des programmes de vaccination. Le CCNI continue d'examiner les données probantes au fil de leur évolution. C'est pourquoi les Canadiens peuvent s'attendre à ce que le CCNI mette à jour ses recommandations au fur et à mesure que les données évoluent. Les provinces et les territoires tiennent compte des conseils du CCNI, mais les décisions en matière de programmes d'immunisation leur appartiennent. Le COVID-19 cause encore des hospitalisations et des décès au Canada et certaines provinces sont aux prises avec des taux de maladie et d'hospitalisation importants, mettant à rude épreuve leur système de santé. La vaccination est essentielle pour mettre fin à la pandémie de COVID-19. Le 5 mars 2021, Santé Canada autorisait l'utilisation du vaccin Janssen de Johnson & Johnson contre la COVID-19 pour les personnes âgées de 18 ans ou plus. Comme ce vaccin contre la COVID sera disponible sous peu au Canada, le CCNI émet ses recommandations aujourd'hui. Le vaccin de Janssen est un vaccin à vecteur viral à dose unique qui peut être conservé et transporté à des températures de réfrigération habituelles. Lors des essais cliniques, le vaccin Janssen à dose unique s'est avéré efficace à 67% dans la prévention d'une infection à la COVID-19 symptomatique, modérée à sévère, dans tous les groupes d'âge, au moins 2 semaines après l'administration du vaccin. Le vaccin a également été très efficace dans la prévention des maladies graves et des hospitalisations. De plus, des données préliminaires suggèrent que le vaccin offre une protection contre le variant préoccupant B1351, signalé pour la première fois en Afrique du Sud, et contre le variant d'intérêt P2, signalé pour la première fois au Brésil. Il n'y a actuellement aucune donnée sur le variant préoccupant P1, qui lui aussi a émergé au Brésil. Comme pour le vaccin d'AstraZeneca, des cas confirmés de thrombocytopénie thrombotique immunitaire induite par le vaccin ont été observés après l'administration du vaccin Janssen. En date du 23 avril, 17 cas ont été confirmés suite à l'administration de plus de 8 millions de doses du vaccin Janssen aux États-Unis. Le Advisory Committee on Immunization Practices, l'équivalent américain du CCNI, a tenu des réunions d'urgence pour examiner ce signal de sécurité et a conclu que les avantages du vaccin Janssen l'emportaient sur les risques. Comme pour le vaccin d'AstraZeneca, le CCNI a évalué les avantages du vaccin Janssen à diminuer les hospitalisations aux soins intensifs et les décès causés par la COVID-19 contre le risque de développer une TIV. Présentement, compte tenu des données actuelles, le CCNI recommande de proposer le vaccin Janssen, comme celui d'AstraZeneca, aux personnes âgées de 30 ans et plus, sans contre-indication, si la personne préfère être vaccinée plus rapidement plutôt que d'attendre un vaccin à ARN messager et si les avantages l'emportent sur les risques. Cette recommandation fournit aux provinces et aux territoires des orientations sur la manière d'optimiser l'utilisation du vaccin Janssen afin d'obtenir le plus de bénéfices possibles en matière de santé publique. L'analyse des avantages et des risques pour la santé publique de l'utilisation du vaccin Janssen peut varier selon les endroits. Les provinces et les territoires se doivent donc d'adapter le seuil d'âge recommandé par le CCNI en fonction de leur situation particulière, notamment l'épidémiologie locale de la COVID-19, l'approvisionnement en vaccins, la logistique, ainsi que les considérations relatives à l'équité. Par exemple, comme le vaccin de Janssen est à dose unique, celui-ci pourrait mieux convenir aux populations pour lesquelles il est plus difficile de programmer une seconde dose. Les décideurs pourront se référer à l'outil d'évaluation des risques dans la déclaration mise à jour qui les aidera à déterminer comment utiliser le vaccin Janssen. Le CCNI continue de recommander de façon préférentielle les vaccins autorisés à ARN messager contre la COVID-19 en raison de l'excellente protection qu'ils offrent et de leur profil d'innocuité, en particulier l'absence de signal de TIV. Le Canada s'est procuré et devrait recevoir suffisamment de vaccins à ARN messager pour vacciner l'entière population canadienne actuellement admissible avant l'automne 2021. Le CCNI a également renforcé sa recommandation de vaccination pendant la grossesse. Le CCNI recommande d'offrir une série complète de vaccins contre la COVID-19, de préférence avec un vaccin à ARN messager, aux femmes enceintes si les avantages l'emportent sur les risques pour la mère et son fœtus, et si le consentement éclairé comprend une discussion concernant les données probantes sur l'utilisation de vaccins contre la COVID-19 dans cette population. Une étude récente aux États-Unis n'a montré aucun signal préoccupant quant à l'innocuité suite à l'administration des vaccins à ARN messager contre la COVID-19 pendant la grossesse. De plus, comme le traitement pendant la grossesse d'une TIV qui pourrait survenir après l'administration d'un vaccin à vecteur viral serait très complexe, le CCNI recommande l'utilisation préférentielle des vaccins à ARN messager pendant la grossesse. Le CCNI a également réitéré sa recommandation pour que les personnes précédemment infectées par le virus du SRAS-CoV-2 se voient offrir une série complète de vaccins contre la COVID-19. En l'absence de données sur l'efficacité d'une seule dose de vaccin chez les personnes ayant été préalablement infectées et compte tenu des données limitées sur l'innocuité d'une seconde dose, les personnes ayant été précédemment infectées par le SRAS-CoV-2 devraient continuer à recevoir une série complète de vaccins, quelle que soit la gravité de leur infection antérieure. Pour de plus amples renseignements sur les recommandations à jour du CCNI, y compris les données probantes et les justifications qui sous-tendent les recommandations, veuillez consulter la page web du CCNI. Pour conclure, je voudrais souligner que le CCNI continue d'examiner les données probantes et les données sur la COVID-19, ainsi que les vaccins contre la COVID-19 à mesure qu'ils sont disponibles. Le CCNI continuera de mettre à jour ses recommandations sur l'utilisation des vaccins contre la COVID-19 au Canada au besoin. Je vous remercie de votre temps. Il nous fera plaisir maintenant de répondre à vos questions.
Merci beaucoup. We'll now open the phone line to questions. Our experts are available.
Okay, so we heard some really good news there that, of course, you have the Janssen vaccine by Johnson & Johnson available, and also that pregnant mothers can now receive vaccine, it is determined that it should be safe, and unless there's other extenuating circumstances that would determine not to vaccinate pregnant women. So that was all really good news, and we actually have some quotes here from All Health Canada approved vaccines are safe and effective, and we encourage everyone to register to receive their vaccines soon as they are eligible. Today it includes people who are pregnant. Dr. Bonnie Henry said, the BC's provincial health officer, we have reviewed the data here in BC, and this shows pregnant people experience severe illness from COVID-19 at a rate similar to people who are in their 50s. By prioritizing pregnant people today, we add another layer of protection for them and their babies. So, again, if you're in BC, if you go to gov.bc.ca, get vaccinated and register for your appointment. So, that is great news for pregnant women. Okay, so moving on to what's happening around the world as far as COVID-19 and other health issues. According to the UN, the schools have opened in South Sudan after 14-month lockdown, and they have describing the joy felt by children and aid workers as classrooms reopened Monday after more than 14 months of COVID-19 restrictions. Especially in a country like South Sudan, where also faced with humanitarian emergencies in many parts of the country, schools are places where children are to be safe, to be protected, and also access basic services, schools, school feeding, and so on. Despite the welcome development, the UNICEF officials noted that many children have not been able to return to class, their future development held up by chronic humanitarian emergencies fueled by ongoing violence and climate shocks. So they're still having, the schools are open, but the problem is how do we get the children to the schools. Now, keep in mind, there are still other health problems out there that are putting people at risk, and there are still other emergencies, malaria being one of them, and with that, the Democratic Republic of Congo, they, while experiencing, of course, the pandemic, they were also experiencing an Ebola outbreak, which was just recently declared over. WHO Director Dr. Tedros bringing into a 12-month outbreak in Eastern Democratic of the Congo, and stressed their need to continue vigilance to prevent the return of the disease and other health challenges. Today's declaration and end of the latest Ebola outbreak in the Democratic Republic of Congo is a testament to professionalism, sacrifice, collaboration by hundreds of true health heroes, in particular the Congolese responders. The World Health Organization is committed to helping national and local authorities and the people of North Kivu prevent the return of this deadly virus and to promote overall health. So one of the issues, of course, with the COVID-19 pandemic is that with travel lockdowns and travel restrictions, that healthcare workers can't get to the people who are in need. And it also ties up efforts created by the United Nations and the World Health Organization to get aid to people in desperate need. And these people, of course, are of all ages. We're concerned about our most vulnerable here at home, in nursing homes, and the disabled. When you have a violence in the area or a famine or something that's limiting resources that are readily available here in Canada or the U.S., such as clean water and abundance of food, other health issues do start to pop up. With clean water and available food, we eliminate a lot of health problems such as malnutrition, cholera, and that these other areas that are being devastated by violence and government unrest. They not only have to contend with COVID-19, but they had to contend with things such as Ebola, cholera, malaria, even something as simple as we have here diabetes, of course, but diabetes, when you can't get a hold of insulin, becomes deadly. So we need to keep this in mind, and we need to also, wherever we can, help those efforts to keep all people healthy around the globe. So let's listen to now the latest media update from yesterday from the World Health Organization. Thank you for listening to Depictions Media Radio.
Hello and good day to wherever you are listening to us today. It is Monday, 3rd of May 2021. My name is Christian Lindmeier and I'm welcoming you to today's Global COVID-19 press conference with a special focus on financing equitable access to COVID-19 vaccines, tests and treatments. We have a special guest to discuss the financing of the fight to end the COVID-19 pandemic with a focus on ACT Accelerator and in the context of the G7, G20, and that is Gordon Brown, United Nations Special Envoy for Global Education and former Prime Minister of the United Kingdom. Welcome. Simultaneous interpretation is provided in the 6 official languages: Arabic, Chinese, French, English, Spanish.
Lies and mobile field hospitals. We're also providing advice for people on how to provide care at home for families that are unable to find a hospital bed. For patients with severe or critical disease, WHO recommends treatment with dexamethasone. And WHO and the WHO Foundation are raising funds to support the need for oxygen and related supplies globally. In the meantime, we call on everyone to continue to follow WHO and national advice on keeping safe, maintain physical distance, avoid crowds, wear a well-fitted mask that covers the nose and mouth properly, open windows, cover coughs and sneeze, and clean your hands. What's happening in India and Brazil could happen elsewhere unless we all take these public health precautions that WHO has been calling for since the beginning of the pandemic. Vaccines are part of the answer, but they are not the only answer. On Friday, WHO gave emergency use listing to Moderna's COVID-19 vaccine, making it the 5th to receive the WHO validation. Emergency use listing is one prerequisite for vaccines to be purchased and supplied through COVAX. It also allows countries to expedite their own regulatory approval and to import and administer a vaccine. And we're pleased to note that Gavi has signed an agreement with Moderna for 500 million doses of vaccine on behalf of COVAX. This morning, I met with Sweden's Minister for Development Coordination, Minister Per Olsson Frid, who informed me that Sweden will donate 1 million doses of AstraZeneca vaccines to COVAX. Tack så mycket, Sweden, for this donation, which allows similar donations by France, which follows similar donations by France, New Zealand and Norway, with positive signs from some other countries, and we call on all other countries to follow the example these countries have set and donate through COVAX to help accelerate equitable distribution and access. COVAX has now shipped almost 50 million doses of vaccine to 121 countries and economies. But we continue to face severe supply constraints. Solving this dilemma demands courageous leadership from the world's largest economies. Next month, leaders from the G7 countries will gather for what may be the most significant meeting in its history. The G7 countries are the world's economic and political leaders. They're also home to many of the world's vaccine producers. We will only solve the vaccine crisis with the leadership of these countries. The Access to COVID-19 Tools Accelerator currently faces a funding gap of $19 billion. And we estimate that we will need a further $35 to $45 billion next year to vaccinate most adults around the world. The G7 countries could mobilize a substantial portion of these funds themselves and lead a global effort to accelerate vaccination around the world. We face a shared threat that we can only overcome with shared solutions, sharing financial resources, sharing vaccine doses and production capacity, and sharing technology, know-how, and waiving intellectual property. Today, it's my great honor to be joined by Gordon Brown, the former Prime Minister and Chancellor of the Exchequer of the United Kingdom. As Prime Minister, Mr. Brown has hosted the G20 summit in 2009, when under his leadership, the G20 countries committed to making an additional $1.1 trillion available to alleviate the most acute economic crisis since the Great Depression. We now face an even more severe crisis, and we need the same kind of leadership. Gordon, thank you so much for your leadership, and thank you for joining us today. You have the floor.
As Dr. Tedros has just told us, each week for the past 10 weeks, we've seen increases in COVID cases worldwide. Last week was one of the worst, with nearly 5.7 million new confirmed cases reported and over 93,000 new deaths. And with many communities, healthcare centers in India, Brazil, and elsewhere simply overburdened, overwhelmed, and under-resourced, we are at this critical moment in the fight against COVID-19. And we are face to face with this unanswerable truth that no one is safe anywhere till everyone is safe everywhere, and no country can finally be COVID-free until every country is COVID-free. And for his repeated and accurate warnings to us, and for his impassioned leadership, I want to praise my friend Dr. Tedros and his brilliant staff, and all those across the world who through ACT Accelerator and COVAX are working for vaccine equity. For while the near majority of US citizens and the majority of UK citizens have already received one COVID shot, In hard-hit India, just 10% have been vaccinated. And months since the vaccine became available, less than 1% of sub-Saharan Africa. And this is a man-made catastrophe, because while it took 9 months to reach 1 million deaths when we had no vaccine, in only 4 months since we've had a vaccine, we reached 2 million deaths, and in only 3 months since, 3 million deaths. 1 in 2 vaccinated in much of the West, less than 1 in 100 in sub-Saharan Africa. By our failure to extend vaccination more rapidly to every country, we are choosing who lives and who dies. And I say the world is already too deeply divided between rich and poor to allow a new unbridgeable divide to become entrenched between the world's vaccinated who live and the unvaccinated who are at risk of dying. And it's not only the poor who suffer, all of us do. The longer the poorer countries go unshielded, the more the disease will continue to spread, mutate, and threaten not just poor countries, but rich countries too, including the already vaccinated. So this is a global problem that needs the globally coordinated solution Dr. Tedros has just mentioned. To protect ourselves locally, we need to act globally, with a concerted and immediate push to mass vaccinate the world underwritten by the richest countries to help the poorest, and not as an act of charity, but as a matter of national security for each of us, as the best insurance policy in the world. For the words of President John Kennedy, spoken 60 years ago, ring even truer today. If a free society cannot help the many who are poor, it cannot save the few who are rich. Now, the miracle that is science has given us multiple vaccines, and assisted by licensing agreements and I hope a temporary patent waiver as proposed by People's Vaccine Alliance, manufacturing can be ramped up in every continent soon. But I want to address the biggest question the poorest countries still have no answer to. Who will pay? The cost to a low-income country is prohibitive. The double vaccine at $10 can be an entire week's income for a family. But for our richer countries, the bill for mass vaccinating the world and ensuring access also to tests and treatments is affordable. A total of around $30 billion a year is spread across the richest countries, means just 25 cents a week per citizen. And it is money we cannot afford not to spend. For mass vaccination is not just an epidemiological and ethical imperative, it's an economic imperative. For if the cost of vaccines is in billions, the overall savings is in trillions, trillions of additional economic output made possible when trade resumes in a COVID-free world. Helping vaccinate the rest of the world will cost America up to $7 billion a year. And that's less than 0.5% of the cost of its $2 trillion economic stimulus. And yet the resumption of trade and economic activity that a virus-free world makes possible in 2021 alone will be worth 10 times as much to America. Now, I want to pay tribute to the ACT Accelerator and COVAX. It has raised $14 billion for tests, treatments, vaccines, and PPE. It's signed up 190 countries to COVAX. It has mass secured nearly 2 billion vaccines for the 92 poorest countries. And it sends a message that when it comes to preventing loss of life, we cannot rely on charity alone, but need a systematic plan that does not force us to choose between who lives and who dies. But Act A has yet to raise $19 billion this year, and will need more if we can ramp up manufacturing even more quickly. And in total, over 2 years, we need to raise an estimated $60 billion, not only to cover vaccines, research, production, and distribution to 92 lower income countries, but help pay for vital medical supplies, diagnostics, and medical oxygen currently and shamefully in short supply in India and elsewhere, as Every Breath Counts has shown. Now, based on ability to pay, and that's a formula that takes into account national income, current wealth, and benefits from the resumption of trade, America would pay 27% of the cost, Europe 23%, the UK 5%, Japan 6%, Korea and Australia, who will attend the G7, and Canada 2% each. And I say to the G7, the forum that brings together the world's richest countries, you have the power and the ability to pay for nearly 2/3 of the costs and secure a historic breakthrough by agreeing an equitable burden-sharing formula that could cover global health provision. And you can expand IFM with grants for low-income countries and create guarantee-based facilities for middle-income countries that will maximize available resources in future years. And I say to the G20, with your leadership, we can cover over 80% of the costs. And you have the means to urgently donate vaccine doses, as Dr. Tedros has said, to cover the gap in supply. I say to the richest 30 countries in the world, you can cover almost 90% of the costs. And the same burden sharing formula can also be applied so that instead of the familiar pandemic cycle of panic now and neglect later, the world invests now when there is a cash shortfall and for the future in pandemic preparedness, as Helen Clark's WHO review will highlight, to ensure that even if future outbreaks happen, pandemics become preventable. And I say directly to the leaders of the World Bank and all multilateral development banks and to the IMF, your responsibility also is clear. We, the shareholders, want to instruct you to ensure low and middle income countries can invest in building up their currently understaffed and under-resourced primary healthcare systems that are now at breaking point. And I say to those countries, respond now to the invitation this week from the WHO to submit national capacity building plans so we can ensure delivery of vaccinations and treatment without it being at the cost of so many needs in healthcare that are now not being met. And I want to promise Dr. Tedros and all the world's health workers who are selflessly laboring night and day to save lives, in the next few weeks, we will ensure you have the support from the leaders of Asia and Africa and from Asian African civil society demanding the G7 Act. Support from economists showing that we cannot afford not to act. From medics and scientists demanding the G7 deploy its wealth to end the disease. From people all over the world, just as the LA concert of global citizens did last night, demanding the world now come together at this moment of great peril to save lives. And I say to all with the power to change our world for the better, time is short. We must act in days rather than in months. Let us not repeat the mistakes of the first wave of the disease when the world's failure to cooperate across borders contributed to the loss of 3 million lives. Martin Luther King spoke of the fierce urgency of now, reminding us that in a crisis, there is such a thing as being too late. A crisis like this, he told us, is no time for apathy or complacency. It's time for vigorous and positive action. And we need that now, building on what Dr. Tedros has done, starting immediately by vaccinating every country's health workers, elderly and priority populations. Let us secure vaccines, tests and treatments for all. And let us begin to reunite our fractured world. Thank you very much.
Thank you. Thank you so much, Gordon. And thank you once again for your clear and powerful call to world leaders. Finally, I would like to recognize 3 important days that we are observing this week. First, today is World Press Freedom Day. WHO values the role of a free and fair press in informing the public and in holding governments and institutions accountable. Second, Wednesday marks World Hand Hygiene Day, a reminder that clean hands save lives. And third, Wednesday also marks the International Day of the Midwife, an opportunity to celebrate the vital role that midwives play every day of every year, and especially during the past year. Christian, vielen Dank, back to you.
Okay, so we've heard about Brazil and the call to the richer countries to help out those countries that are going to have trouble paying for their share of the mass vaccination, the mass immunization against COVID-19. U.S. President Biden has actually authorized the sharing of AstraZeneca vaccines with Canada and Brazil, and has also authorized oxygenators and things like that to Brazil because they're in such dire need because of the number of cases that are happening in Brazil. And according to the Pan American Health Organization, that while India is suffering extreme measures and This show has been produced by Depictions Media. Please contact us at depictions.media for more information.